Hi, everyone. Welcome to our live event today. Let's Talk Talks. Thank you so much for joining us today. We're going to give everybody a couple of minutes or a minute to kind of log in. And in the meantime, please feel free to put in the chat box hi or say hi. Excited to be here. Excited to talk about one of my favorite treatments been doing for over the last 18 years, talks. So, and excited to have Susan Brenner to join us.
Thank you. I'm so happy
She's
to be
our
here.
she's our senior director of the clinical operations. So we're lucky to be able to nail her down. She's busy all the time working with our team. She's in charge of all of our team. So give everyone a minute saying hi. Hi from San Marcos. Hi.
Okay.
Okay, I think we can go ahead and get started. I'm going to go over a little bit of what we're going to do today, our agenda. Today, we're going to talk about one of my favorite treatments, tox. Hi, everyone. Hi, Tracy. And then we'll talk a little bit about Revive, give you a little history about Revive in case anyone wants to know, and talk about our amazing medical team. And then we are graced to have Susan here to be able to speak with us about the neurotoxin treatments and go into any other questions you guys may have or information just in general education. Just to give you a little information about Revive Med Spa in case you haven't been with us, hanging tough with us for the last 18 years. We've started in March 6th, 2006. So I have been here from the beginning. So it's been a blessing. We've been surrounded by the most amazing team. We have 3 medical directors in all of our regions. We now have since then spread, or I should say grown, into 3 different regions. We have NorCal. We also have grown in LA, soon to be Laguna Niguel in 2 weeks, which
Very
is very
exciting.
exciting.
Very exciting.
And our original in San Diego. We, have 6 locations here. And one of our medical directors is our co-founder, Dr. Vish Verma, who we all know and love very dearly. We also have Dr. Lee Rogers and Dr. Kim Rappaport that are split among those regions. Today we have Susan Brenner, and excited to have the time with her for sure. She's one of our master injectors, and I'll give you the floor, Susan.
Oh, well, thank you, Christina. And nice to see everybody here. I see your comments and all. Happy you're here. Well, I've been with Revive over 10 years, and I'm the senior clinical director. So my goal is to make sure that our providers give you the best possible treatment. That's the bottom line.
And you do a fantastic job with that.
Thank you.
So we'll go a little bit. I'll ask you some questions that
Mhm.
I know are most common questions that are usually asked. And one of the questions is, what are neurotoxin treatments?
Sure, yes. Well, neurotoxin treatments, these are the most popular non-invasive cosmetic treatment in the country. It is a quick and easy cosmetic treatment and with incredible results. That's why it's so popular. 97% satisfaction rating. So when a patient is injected with a neuromodulator, what that does, that neurotoxins it sends a signal to prevent the muscle from contracting so that it relaxes that muscle temporarily to smooth the skin and relax it so that your wrinkles are smoothed out.
Yeah.
Mhm.
Oh, just so for the record, I'm 100% satisfaction rate.
So a lot of younger patients like to have these neuromodulator treatments to prevent more severe wrinkling and lines that form as we age, and they become etched in our skin over time if they're not treated. And then as we mature, it relaxes to those muscles to give you a more youthful appearance.
So those are the good candidates for the neurotoxins, correct?
Yeah, starting in your 20s, you're not producing as much collagen. You start noticing those fine lines. So it helps prevent them from being etched in your skin and becoming deeper.
Nice.
Mhm.
So preventative
Yeah.
as well.
And then here is this just shows you when it's a very fine needle, and when that's injected into the skin, it goes to where the muscle and the nerve interact. And that's where the magic happens. And it's uh, the product binds to the acetylcholine, and that's the chemical that gives that signal to contract muscle.
Wow.
Therefore, you're not able to contract with that.
Nice.
And then after 3 or 4 months, it loses its effectiveness, and if assuming that you have an appropriate treatment.
Nice.
Yeah.
So it can last up to or stay.
3 to 4 months is average with a standard dose. Mhm.
Nice. And what are those treatable areas?
Oh, well, there are many treatable areas. Well, first, let's look at this
Oh,
slide here. We do a full assessment. So your provider will assess you to make sure that there are no contraindications for your treatment. Make sure, you're not pregnant or breastfeeding. And actually, there are studies being conducted right now. So there's some data being collected about breastfeeding. Um, and so far it's been very positive, meaning there's no negative association with neurotoxin and breastfeeding, but it's not conclusive yet. So we have to rule out patients who are pregnant and breastfeeding, as well as those who have an allergy to neurotoxins.
nice.
Mhm.
Makes sense. Yeah. Yep.
And then next slide
So
there.
these
Mhm.
these are the one questions. What are the treatable areas that we often get?
Yeah, so this slide, you'll see a list of common areas that are injected. The 11s, those are the forehead, are the frown lines right between your brows. And then up above those 11s is the forehead. That's commonly treated. We get the bunny lines, which is when you scrunch your nose, right? Can you
Yes.
scrunch your nose? I have neurotoxin in mine, so I probably can't scrunch right now. The bunny line, okay, those bunny lines, and then the crow's feet around your eyes. And when those are injected, it not only smooths those dynamic wrinkles, but it also opens up the eyes a little bit. That's the most popular area to be treated. The lip flip. So when neurotoxin is injected right above the lip, it raises that lip up a little bit, giving the appearance of a little fuller lip. Platysma bands, those are exactly, Christina is demonstrating these right here. So they become more prominent as we mature, and those can be injected and so that they're less prominent. It relaxes that muscle. And there are many other areas that we treat as well. A lot of my patients like the Nefertiti lift, and that's where neurotoxin is injected right above the mandible. And I'll show that when I do the live demonstration. Also in the chin, we get these it's called peau d'orange, or an orange peel type consistency in the chin. And when neurotoxin is injected there, it relaxes that muscle. A lot of patients love the brow lift, and it's just a few units in the lateral part of this lateral side of the brows to just give a little subtle lift. And I'll also show that with the patient live.
I have a habit of showing everybody. I always go into my provider and go, do whatever you want to do. What do I need?
Yes, and during the consultation, the provider will first ask the patient what bothers them the most, and
Yeah.
then it's our job also to make some other recommendations if the patient is open, because a lot of times patients don't know where
Yeah.
we can inject it, and patients like coming to us, we're a resource.
Yes, definitely. So Susan, we're getting the question. What are the different kinds of toxins out there?
Yes, so we carry Botox, Dysport, and Daxxify, and Jeuveau. Let me just start with Botox and just tell you a little bit about it. So most people are familiar with this brand. This was the first on the market. It came out FDA approved for cosmetic treatments in 2002. So it's been around over 22 years. And before being approved for cosmetic use, it was used therapeutically, and it still is for masseter muscles, for twitching around the eyes. It was actually first used for that, and then many other therapeutic uses. So that was the first on the market. It's a brand. So a lot of times people think of neurotoxin as Botox. Well, Botox is a brand, just like Kleenex is a brand. There are other brands as well, and honestly, I love them all. I use them all. They all work well for me. But individuals have their preference. Some of my patients will tell me one works a little better for them. It lasts a little longer, kicks in a little faster. So it's really an individual preference. Dysport is the second brand that became FDA approved for cosmetic use, and it came on the market about 10 years after Botox. It has a little greater diffusion, and that can be really helpful. For example, let's say crow's feet, a patient has a lot of dynamic lines there. It diffuses a little bit more, covers a little bit more area. And then the next, we have Daxxify. That is the most recent toxin on the market. And that came out about 2.5 years ago. It was stripped of some accessory proteins and human serum albumin, which is in all the other neuromodulators. And so it's often referred to as the vegan toxin for that reason. It kicks in a little faster than the others for most individuals. And some patients report a skin tone improvement. So that's another possible characteristic of this brand.
And I've used all of them. They all seem to work well.
Yeah.
Even at my age of 52, I know sometimes people go, oh, is there a certain brand? It's just really relying on your provider.
Right. And they are differentiated, just their formulas are a little different, their proteins are a little different, but they all work the same way and accomplish the same thing.
Yeah. We're going to dip into a little before and afters, which is exciting to see. I love looking at these because you can really see what it does for you. Susan, can you tell us about the
Sure.
forehead?
Yeah. Well, you could see those lines, and when you're with the provider, they will assess to see how thick and strong those muscles are, and that will help the provider determine and recommend a certain dosage to you. And then you can see how smooth her appearance is. It takes up to 2 weeks for any of these neuromodulators to kick in. And even if it kicks in, if one kicks in a little quicker, it may take 2 weeks for the full effect.
Yeah, and it looks beautiful to me, a very natural look for her. She looks great.
Right.
For sure.
I agree.
And then
Beautiful.
our next
Oh yeah,
round.
this was my patient. You could see if she didn't get a treatment, how you could see that deep line that would just become etched in her skin over time. And she's quite young, and in her case, I injected 20 units of Botox, and that is the FDA approved indicated amount. Some patients need more, some need less. But this is what I started with for her. That was her first treatment, and she was really pleased with the outcome.
I mean, very natural look too for her.
And she's frowning in the after. You could see she's got very subtle movement, not very much, but she was very pleased with that result.
A good example of preventative.
Yes,
for her. She
absolutely.
was very young, but definitely.
Yeah.
Yeah, great. Oh, good. Good
Yeah.
area, crow's feet.
Yes, the most popular area treated with neurotoxin, and you could see it has helped smooth those dynamic wrinkles. And well, you can't see her eyes here. We have to have those covered, but it does open up the eye a little bit, and just giving you a more alert, very natural, but more awake appearance, refreshed.
Yeah,
Mhm.
those are
Oh,
great
yeah.
metaphors. Lip flip.
And this is an example. This is what I was mentioning before, how it raises that lip a little bit. And it's not going to last in this area as long as others because we use our mouth for eating and talking. And so, and it's a small dose, maybe 4 to 8 units there. And so it does break down a little quicker than the other areas, but patients love this treatment.
Yeah, I get it then.
Yeah.
And the
Yeah.
gummy smile.
So,
So now we get to move
okay.
on to the next fun part of us doing a live demonstration. Susan's going to do that for us. This was all very good information. I hope that you guys learned something and obviously keep your questions coming. I'm sure it kind of stimulates the conversation between all of us. And Susan, I'm sure, is happy to answer some of those questions as she's injecting. So feel free to type them in there and we're going to go ahead and get started.
Okay, so here we are. I'm with our model, Caitlin, who so graciously offered to be here and be our model today. So Caitlin, you can say hello. So Caitlin and I have already talked. She's been medically cleared for this treatment. She's had neurotoxin before and has been really pleased with results. So I'm just going to demonstrate. You could see how really quick and easy this treatment is. There are certain areas where, she wanted me to stay away from, well, first of all, she doesn't need platismo treatment. She doesn't need the Nefertiti lift either. She's quite young, but we're going to treat the areas where there's muscle movement, and you could see when she frowns. Go ahead and frown for the movement here. We're going to treat the glabella, and then go ahead and raise your eyebrows. And you can see these lines up here to help smooth these lines. And then when she squints, yeah, you can see there. But I will talk about some of the areas where we're not going to be treating her, just so that you know where this is injected. So this is the mandible right here. A lot of people like the Nefertiti lift, where we place a few injections right along, right up above the mandible there. And then, I showed you with Christina, her platysma bands and how that's treated. But today, and then the lip flip would be just right above the lip. We're not going to do that today, but I'm going to start here with the glabella. You can see where I've marked for the injection sites. So I'm just going to clean a little bit with alcohol. And bruising and bleeding is a common side effect. Talk about some of the other potential side effects. Some people get a transient headache. It's the chances are you're not going to have one, but if you get one, it's you take Tylenol for it, but it's pretty transient. So it like comes and goes. Okay, Caitlin, are you ready?
I'm ready.
Okay, here we go. And I'm just gonna inject right in this muscle here. And then frown for me, Caitlin. Eyebrows together and relax.
And there's a question of what causes bruising.
What? Well, you've got a needle going in you. Yeah. So a needle can hit a blood vessel and cause bruising. Go ahead and frown again. And then relax.
How do you How many units for that area?
Yeah, so
Like, how many
that
units are in
sure.
How many
And that's
units
going to vary. The FDA approved indicated amount is 20 units there. Okay, and as I mentioned before, some patients need more and it just depends on how thick and strong those muscles are. And some don't need quite as much. Um, you have to keep in mind there is an association with dosing and longevity. So if you are underdosed, you're going to be less satisfied with the outcome and it's not going to last you as long. So now I'm going to go to her forehead. Go ahead and raise your eyebrows. Okay, we're going to get this whole frontalis muscle and relax there.
A good question for you.
Sure.
Do you find that patients, Lori's asking, do you find that patients who start talks earlier in age do better than someone who's had their first treatment 2 months ago at the age of 56? That's a very good question.
Yeah, that is a good question. And I'll tell you, with my personal experience, I actually didn't start using neurotoxin until I was 50. So, and it's worked for me. But ideally, it's starting earlier to help prevent those lines uh, is recommended. Yeah.
Someone's asking if you were numbed. Caitlin, were you numbed?
No,
No.
you can't even feel it.
They're loving your smile.
Yeah, let's talk about your experience here. So you're not really feeling anything.
No, it's just like little tiny little pokes.
Little pricks.
Someone's asking, Renee is asking, is it true that metabolism affects longevity?
That is a good point. It's the heat. So one of our recommendations is to not work out for 24 hours following your treatment. And patients who work out really hard, do these sweaty workouts every day, it creates more heat in that area. And so the product is the bond will break more quickly in those cases. Mhm.
I didn't know that. Good to know.
Yeah.
So, yeah.
But I work out most days and I've really not had a problem, but there is an association. Yeah.
Learn something new.
Okay, go ahead and off of me and then relax. Okay, we're going to treat here around the crow's feet. Still no discomfort.
Mm-mm.
Very little.
Other than the lip flips, are there other areas you can treat around the mouth?
Yeah, so this is called the depressor angular oris muscle when a patient, and she doesn't have this issue. So some patients, their mouth draws down. And when it does that, we can inject there to help bring that up a little bit. But I'm not going to treat her there because she doesn't need that. And then we're going to do bunnies now. Go ahead and scrunch you. Perfect. And you see, I treated her brow as well. That's for the brow lift. And I'm going to put just a little bit in her chin. This is to help she has a little bit of wrinkling here. So there are different techniques. But this is what I like to use.
How long is a typical appointment for neurotoxin?
Well, we offer, typically we have a half hour, but that includes consultation, assessment, and also sometimes my patients like to get another treatment. And if I have the time, then I fit that in as well. Mhm. But you could see this, I've already done with this side. It's very quick and most patients tolerate this very easily. Well, I'm going to go to the other side. Are we okay with the camera there?
The questions coming. These are great questions. Thank you for interacting.
You know, another thing that Caitlin and I talked about is a little injection underneath the eyes. Because when she smiles, when I squint really hard, and you can open your eyes. Oh, okay.
There we go.
You can see there's a little dynamic movement there, so I'm just going to put a little drop right under the eye as well. Go ahead and look up. I do this. There we go. Okay.
We have a question. Is it best to wait until you have full movement back before getting another treatment, or to nip it in the bud sooner?
Well, the recommendation is to wait at least 3 months. I have a number of patients who like to be treated every couple of months, and that is fine. There are some studies that show there's a low risk of building a resistance to it, but because it's not common and it's a low risk, we permit that. Yeah.
In my experience too, I come in every 2.5 months. I tend to be the one who runs hot.
Go ahead and look up again. Okay. I think we did it.
That's
Yeah.
right. Awesome.
She was a great model.
Yes, thank you so much, Caitlin. We appreciate it.
Yeah, thank you.
Are you excited?
Yeah, I'm very excited. I'm like, is that 2 weeks already?
Okay, so we could just that around here. Thank you.
Yeah, you're
so
welcome.
much for your great attention and answering those questions for us, and Caitlin for being a great model for us. I want to say thank you to everyone for all your great questions and your interactions with us. I think it's important for us to have these great conversations. It helps educate everybody, and please stay up to date on all of our promotions and events through our Instagram at ReviveMD, TikTok at ReviveMD, and Yelp at ReviveMD or MedSpa. Thank you so much.